So when people are sick, they go to the hospital to see doctor, but they forgot that their house is also a hospital. So a family house is a hospital. Yes, it has wards, it has a pharmacy, it has consultation room, it has recovery room, it has doctor, nurses, staff, nurses, and patients. Yeah, that is hospital for you. It's actually is your home. Your house is structured that way. But if you understand it from that aspect perspective, you will be able to optimize your health and reduce your frequency of coming to hospital. You see, one thing is this, well, when person is sick, when it comes to hospital the first time, it's always meant to see doctor at the consultation office. And this is where they tell the doctor all of his problems, and the doctor decide what the problem is, take history, examinations, do some recommended investigations, and make diagnosis of the problem. So it will tell you that you are having malaria, or you're having typhoid, or you're having hypertension, all of this. This decision is made in the consultation office of the doctor. So let's come down home now. At home, you have consultation office everywhere. You have consultation office in your living room. You have consultation office in your dining room or a table. You have consultation office inside the bedroom. Now, in the living room, this is where the family discuss or observation is made. The mother, anybody can be the doctor. Whoever first discover what's wrong with it within the children, within among the member of the family, at that moment serve as a doctor, because the work of a doctor is to identify the problems and provide solutions. So we discover most times it's the mother that serves as a doctor in this case. We discover that this child is not feeding well, this child has been stooling, this child is feverish, this child is not growing the way I want him or her to grow. Do you understand? That is the mother doing the work of a doctor. So at that moment, he has discovered a problem in one of the patients in the one of the patients, which is a member of the family now. You understand? He might even make the same diagnosis from the husband. This man is depressed, and this man is not the kind of person I used to know. There's something wrong somewhere. He's suspecting a problem. That is a doctor doing the work in the house. So the next thing will be what the doctor in the hospital will ask. What is my plan? What is the next line of action, having discovered this problem in this patient? And that is what the mother or whoever discovered a problem in the family will ask. Maybe the child is not eating well. The child is eating the right not kind of food he's supposed to be eating, or the child has not been interacting with the other member of the family. That is, he's reasoning along a pattern. The next is going to be nice to provide solution. What looks like a kind of solution is going to provide. That which in the hospital, this is a doctor writing prescription. He will now make a prescription. And the prescription now is, in the hospital, you write out drugs for for the patient to go and get and treat himself. So after writing the drug, the patient proceeds to the pharmacy. Now, in the house, the way a prescription is made is decision. The mother, who is in this case maybe serving as a doctor, may discover that the food they're eating is not the kind of food they're supposed to not to eat, and decide to change a pattern or change the food, or maybe cook a different food, or maybe the child don't used to write this kind of food or whatever. So in that case now, in that particular case, he is making a prescription, and the prescription of the medication or the drugs is prescribing is the food. And where did they get the drug in the pharmacy, in the hospital, the pharmacy? So in the house, the pharmacy in your house is your kitchen. And that is where drug is dispensed, and that is where food is served. So the food is prepared in the kitchen, and that food is the medicine that the children and other member of the family eat. Everything in the hospital, every part of the sorry, The kitchen in your house determine the health status of the whole member of the family, because that is where the foods every person eats, the drug, which is the food every person, member of family take, come from. So if it is poorly prepared, if it is packed with junks, that means you guys are maybe eating what looks like a food that has a drug that has a very bad side effects. So if it is healthy food, natural food, you are eating real medicine that heals the body. So that's why what comes out from the kitchen defines the health status of the family. If you're the kind of person that every time indulge in junk like noodles, spaghetti, and all of those things that are classified as junk food, it will reflect in the health status of the whole member of the family. You will see progressive weight gain. You will see type 2 diabetes. You will see other chronic metabolic diseases, because the drug you are dishing out from your kitchen is a poison that is causing problems. And that's a big problem now. So that means you're not a good doctor, as a mother or as a caregiver, whoever is working as a pharmacist in the kitchen. So if you do a good job, go back to the kitchen, reform everything and change everything and encourage a real natural food, you discover that the health of the whole family will be changed and everybody will be very healthy. Now, if you're a good doctor in the house, like a mother or a caregiver that understand the gut health, you discover that junk food will not be found in your kitchen because they destroy the gut microbiome. So you are now trying to build a very good pharmacy that dish out a good drug that heals the body. Okay, let's move away from the pharmacy now. Every hospital have a disposal unit, what they call a waste management unit. And where's the waste management unit? The hospital doesn't joke with death, anything dirty, because that's a source of infection. So they make sure the waste management units are always actively removing any form of dirt. You see the hospital they sweep the hospital every time to keep it clean. And that's where it comes to. Every hospital has a waste management, every house has a waste management system or unit. And where is that? It is there in your dustbin area in your bedroom. You see, bedroom is basically where you reduce a lot of infection in the house. In the bedroom, you wash your hand, you clean your body. That means those things that would have caused disease, which like bacteria or other microorganisms, have been reduced. So keeping the bathroom clean, encouraging children to wash their hands is a way of you doing the work of a waste management team or unit in a hospital at your home. You see how good it is. So now that is your hospital. That's your house. You sweep the house, you are doing the work of a cleaner in a hospital. Do you understand my point? Okay. Now, every hospital have intensive care unit or ICU. And if you look at one thing, or ward, there's one special thing about the ICU or ward or recovery room. There is no always noise in the ICU. Sorry, they may be having some beep of monitor, but ideally, an ICU should be a quiet place. Now, where is ICU? Where is the recovery unit in your house as a hospital? And that is your bedroom. You are meant to make your bedroom as cozy as possible, because your bedroom is the most important place, in addition to your kitchen, in the house. Because there you sleep, your children and your wife sleep. And sleep, a healthy sleep or adequate sleep in the bedroom is restorative. That means it's going to build the health of the children, of the member of the family. So, keeping some distraction away from the bedroom, like lightning, excessive lightning, Televisions, phone, laptop out of bedroom is a way to encourage a healthy sleep that restores your body. A good sleep can balance your hormone. A good sleep can build your immunity. And a good sleep can encourage a growth of your children. And that is why it is called recovery room. It is a bedroom. What else am I missing in the hospital that is not there in your house? You see, every part of the hospital has been a little bit represented in your house. So if you understand this concept that your kitchen is your pharmacy, your bedroom is a recovery unit, your toilet is a voice management unit, you will understand that if you can understand this rule, basically, you are now seeing your house as a hospital. What about the management of the house? Remember that a patient in the house, in the hospital, and patient in your house can be anybody. We have three categories of patients in your house. One is a sensitive patient, and that is the children. The children are basically the sensitive patient. That is, they come up with acute illness that you notice so fast, and either through fast solution of treating of it, maybe a fever, you tackle it, or you refer by taking the children to the hospital. And we have the silent patients, and those are basically the elderly ones, including the mother, is under these categories. They may be having sickness, some problem, but they may not like it to affect other members of the family, and they keep quiet and silent and deal with them personally. You get? So they have the late presenter, which is a late presenting patient. The late presenter basically fall under categories. Those of them that they allow the sickness to stay inside them and they present very late. Basically, I can always classify the father under that category. So visually, anybody can be a patient in the house, and anybody can be a doctor, especially the mother or the father or the caregiver in the house. Okay, so that is it. But who is the CMD? Like every hospital have a CMD, Chief Medical Director. A CMD make a decision, make a policy of the hospital, and decide how hospital run. Basically, that is what the work of the CMD. Now, in the house, who is the CMD? Good. And the CMD in your house is the father, the head of the family. Okay? He is in charge of providing the facility that is needed inside the hospital, your house. He decides what and what should be done in the house. When children should go out to play, when children should read their books, when children should go to sleep. He decides the day-to-day running of the house, and that is the work of the man in the hospital and the man in the house at the same day of the hospital in the house. Now, the other part of the house that is not touched is the recreational part, that is a compound. The compound allows interaction with the nature, and that's why every hospital have an outdoor or what I call recreational area. In a major hospital, patient come out to interact with the nature, take fresh breaths, and at the same time uh, have a good sunlight, vitamin D from sunlight. So that is the same thing with every house. If you want your house to look like a hospital that promote the health of the member of the house, you must learn to encourage the member of the house to interact with the nature. You don't lock the children indoor all through. They should go out there and play, interact with the people, with other members of the family. That is to say that your compound represents the psychological unit, the psychology unit, or what you call medical psychology in the other side. But this side, this is psychology unit because it trains the children to socially communicate, to interact with other members of other children in the compound. At the same time, benefit from some healthy bacteria that are in the air, inhale them, and enrich and encourage the biodiversity of their gut microbiome. At the same time, the good sunlight that give vitamin D to the skin, basically, basically, those sunlight they tap from it. That's how beautiful it is. So the moment you start seeing yourself as a doctor, you will know the responsibility you need to play in the house. But what a good doctor do is, or what a good doctor does is, any case that is beyond him as a doctor, what he do, he refers to a specialist. And that is by extension, in the house, any condition that you've seen, the child is not doing well, and you've done a little first aid treatment, and there was no improvement, you refer. That is you bringing your children to the hospital. So having this mentality of the house as a hospital is the best you can think of, and always believe in yourself and focus on building the good gut health of your children or the member of the family. You will be far from chronic metabolic diseases. It's a common language you're speaking. Feed the guts the right food, then protect the liver, and you'll be fine.